top table. We'd like to start by Assistant Chief Inspector giving you a brief overview from the police perspective, then we'll move on to Chris Burke, who's Chief Executive of the hospital. Then we'll take questions. If you could put your hand up and tell us where you're from, give us a name and where you're from first, and then if we can try and marshal the questions, that'd be really helpful. So I'll hand over to Assistant Chief Inspector.
Good morning, ladies and gentlemen. Ian Hopkins, Assistant Chief Constable with Greater Manchester Police. The first thing I'd like to say is that our thoughts continue very much to be with the families of Tracy Arden, George Keep and Arnold Lancaster. The anguish that they must be feeling at this time will be terrible. And I would like to reassure them that we are doing all that we can to find out as quickly as possible what caused the death of their loved ones. This is an ongoing complex investigation, as I'm sure that you will appreciate, requiring detailed forensic analysis of a number of scenes and of items within the hospital. We're also very much reliant upon results from Home Office pathology, and again, that will take some time. We have had a team of 60 very experienced detectives from our major incident team working on this investigation around the clock since Friday. We're doing that because obviously we want to get to the bottom of it as quickly as possible, but we're also balancing very much so the need to gather detailed evidence that will hopefully lead to the prosecution of an individual at some stage in the future. And that is a real fine balance between the quality of the investigation and the speed, and one in which the senior investigating officer is constantly reviewing. We also, as police officers, recognise that this is a very difficult time for all of the staff here at Stepping Hill Hospital. It is very apparent to us that the staff are dedicated professionals whose primary function is saving life and the care of patients. And we are trying to work very much with hospital senior managers to make sure that we don't disrupt the normal day-to-day running of the hospital and allow that care and treatment of patients to continue. But our primary responsibility as investigators lies to the coroner and to the families of the deceased. And therefore, the hospital are being extremely patient with us in carrying out our function of that investigation. Over the weekend, we have met every single day with senior leaders from the hospital, from the Strategic Health Authority, and from NHS Manchester. And we've worked very closely with all of them to make sure that there are control measures in place around the hospital to help them protect people who are patients here from any harm. As I have said, with this being a complex investigation, it's unlikely that there will be very early arrests. We have spoken to somewhere in the region of 50 witnesses so far, and that number continues to grow. Obviously, at some stage in the future, the senior investigating officer will make a decision as to when they wish to arrest anybody that we feel may need further investigation. That is not to say that those individuals are guilty of any offence, but it is just a means of us continuing a thorough investigation. I think you're aware that later this morning, the Home Office pathologist, Mr. John Hard, will be opening the inquest into the 3 people who have died. And we're working very closely to keep the coroner informed as to the progress of our investigation. We continue to seek further witnesses and have been asking that anybody with any information can contact Greater Manchester Police on 0161 856 2480. I would just now like to hand over to Dr. Chris Burke, Chief Executive of the hospital, who will say a few words on behalf of the Hospital Trust.
Could I begin by adding the hospital's condolences to the families of those that died, sympathy to relatives, but also to the wider group that have been affected. Our staff have been to see all of the families involved and offered our support during this enormously difficult time. I'd like to add that our staff are shocked, horrified and angry at what's happened, and they're appalled that a place that should be for care has become a crime scene. This is a criminal act perpetrated by someone with malicious intent. And we don't believe that it could have been anticipated. Since the moment we realised this act had taken place, we've been working closely with the police, who we alerted immediately. Whilst I know that's of no comfort to the families that have been affected, I'd like to place on record my extreme gratitude to the very vigilant nurses that got to the bottom of the outbreak very quickly for those patients that were suffering low blood sugar last week. Thanks to her swift action, within 24 hours, Greater Manchester Police were on site, helping us get to the bottom of what's taken place in this hospital. We remain working very closely with the police on all aspects of security to minimise any further risk to patients. We've taken those actions and we continue to review that security on a daily basis with senior police officers and outside experts. Can I stress that patient safety is paramount, our top priority? I would understand why patients would be worried about coming into this hospital, but I can say that it's safe, and by working closely with the police, we hope to stop further episodes like this happening. If anyone is concerned, I urge them to contact our patient hotline number, which is 0161 419 4888, and we will then take a note of that concern and give them reassurance and get back to them. Thank you.